sure it was very educational for all of you. And like Mr. Madrick said, if there are any questions, now's the time. Yes?
In these bronze, silver, platinum, in those plans, will there be a deductible?
There will be a deductible, and so in these plans there are caps on that deductible. The deductible also is heavily weighted towards hospital-related expenses as opposed to routine-related expenses. So many just regular preventative services are covered free of charge, or they are covered and don't necessarily count towards that deductible. The deductible is a sensitive issue given the fact that, as we just mentioned, obviously you have an insurance premium which you need to pay, which for individuals can be challenging. Hopefully we'll make that a little bit easier, but there will be deductibles in these plans.
The deductible, one of the carriers that I spoke with told me that the deductible, at least in one of the levels, is $5,000. And my concern is that that person will not have $5,000, and when they come for well visits, it's fine, but when they come for sick visits, I won't get paid.
Sure. For some of these plans, you are correct. There are deductible levels that will go all the way up. I think the absolute highest deductible level that we saw in one of our plan designs is around $6,250. So the trade-off here in designing these benefits, as you are all aware of, is providing a robust level of coverage while also trying to balance out price. There's only so many levers to pull between copays, coinsurance, deductibles, and the premium, and these are the benefit designs that have been approved.
How committed is the exchange to promoting wellness prevention? Typically, that has not been the focus of previous insurance carriers. So, how committed are you to that initiative?
Yep. So for the exchange, obviously we don't underwrite products. Right? We're not an insurance carrier. We don't carry any risk. We don't provide any sort of benefits. We really are truly a marketplace. But to build on your question, we view the individuals that we service as our customers. And so one of the things that we have spent a lot of time talking about internally is this very issue, meaning that if we get individuals insured or in these particular plans but don't change behavior, I'm not sure how successful we're going to be at actually making any sort of change here in our state. Said differently, obviously for many of the individuals that we're going to be marketing to, the ER may be their primary means of care. And so we need to make sure that we change that behavior. If you have now a private insurance coverage and continue to go to the ER for all your needs, I don't think that would necessarily be positive change. Wellness is one of those components as well. And so as we focus on October and just getting the system up and running, the next phase of this we'll see what I'll refer to as member-focused or member retention programs, of which wellness would be a key component.
There's a good chance that a lot of people, because the penalties are fairly small early in the first few years, will forego insurance. All right, they get a bad diagnosis, all of a sudden they want insurance. All right, what's the time lag in going to the exchange once they get the diagnosis? Like they go to the doctor, get a diagnosis, go home, go online, and they buy something. Is there any problem with them doing that?
Yeah. So the first part of that question is the issue around the penalty. So for the most part, the penalty is around $95 for most folks if they choose to not have credible coverage lined up as of January 1st. That's a fairly anemic penalty, and I think there's a lot of concern that that's not necessarily going to be an effective tool to motivate people to actually purchase insurance. That obviously ratchets